Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I talk to Eastern medicine practitioner and holistic fertility coach, Dr. Juli Yelnick. Dr. Yelnick holds a doctorate of acupuncture and a Master of Science, along with certifications in herbal medicine and global health. Julie's journey into this field is a deeply personal one. After facing her own struggles with fertility and reproductive health, she made the courageous decision to leave her career as an anthropology professor and dedicate herself to helping others navigate similar challenges. In this illuminating episode, we address a topic that resonates with many women, the often challenging and emotional journey of trying to conceive. With countless approaches available, navigating this path can often feel confusing and overwhelming, which is why in this episode, we explore the intricate world of fertility through the lens of Eastern medicine and uncover how ancient practices can beautifully complement modern approaches to conception. So whether you're just starting to think about your fertility journey or you've been trying to conceive for some time, this episode is filled with actionable advice and encouragement that will help illuminate your path toward motherhood. Julie, thank you so much for your time today. It's fantastic to have you here with us.
Thank you so much for having me.
I know I say this all the time, but I am so excited about this because I think I've got some personal interest in this area as well. And for those that don't know, that listen to the podcast, I do pre-recording discovery calls with my guests. And after talking to Julie, she's convinced me to have a look down some of these paths that we discussed. And I've got an appointment with someone next week, so that's exciting. But let's just begin by starting with how Eastern medicine defines infertility and how this differs from, say, your Western medical kind of definition or diagnosis.
Sure. Yeah. I think that the biggest difference to start with is that in modern Western terms, they tend to give couples or women or men a diagnosis related to fertility. And they tend to be very much like, that's what it is. End of the
Mhm.
story. Like you have PCOS or you have endometriosis or you have unexplained infertility. And that's end of the story. So here we go to assisted reproductive technologies the next time. And in Eastern medicine, we see it much differently. We see your fertility challenges as these kind of shifting, moving imbalances that can almost always be changed. And so when I tell someone we say a pattern of imbalance instead of the word diagnosis, first of all. And I think that represents the fact that it is just a pattern that might be temporary. It might be a tendency, but it can almost always be shifted and changed and rebalanced in you, and then it can go away. So if you have a pattern of imbalance, like kidney yang deficiency, for example, is a common one, I might be able to work with you through food and acupressure and other natural modalities, and we can resolve your kidney yang deficiency. So now you no longer have what you might have been told was a luteal phase defect or low progesterone or something else that a kidney yang deficiency was causing for you. So it's very much more open-ended for us and very much more potential for change. And I think that's really the biggest difference.
That's so interesting, isn't it? You've mentioned common patterns or patterns of imbalance. What would the common patterns of imbalance be, or like how would they be identified in Eastern medicine? And how can that kind of contribute to infertility?
Sure. So we go by which organ system is most affected to find out the problem for someone. So anyone can come to us with fertility challenges, whether they have a diagnosis or they don't have a diagnosis, whether they've been checked out or they haven't been checked out. It doesn't really matter for us. So what we'll do is the 10 classic questions where I'll ask you things about your sleep, your moods, your digestive system, head to toe, really, and a lot of questions about your period too, of course. And then I'll look at your tongue. Your tongue is like your body's report card. So then I can look for clues that will tell me which type of imbalance and in which organ system you have going on currently. And again, those change. So it could be different this year than last year. And
Mhm.
then that leads me to your pattern of imbalance, which is your diagnosis, in other words. And there are a few main ones that come up for infertility for women. And then there are also a few different ones that come up for men. Usually it has to do with the kidney. And I think that's a deeper part of Eastern medicine. We attribute a lot to the kidney. So the kidney is kind of like your genetics or like your entire longevity and the energy you were born with and your own reproductive power, if you're going to make more life or not, how long you're going to live, the quality of your health, all of the kind of like preconceived health tendencies that someone has, we would attribute that to the kidney power, the kidney chi or energy. So when someone has trouble with fertility, the first organ system that we go to check for any disharmony is the kidney. And you can either have the kidney yang imbalance, which I mentioned briefly, or you can have its opposite counterpart, the kidney yin deficiency. And those two things will look almost opposite, as you can imagine, since yin and yang kind of form this half of your body, half of your kidney system is yin, half is yang. So we look to see which side of that, which part of that is really the deficient part. And that completely determines what your treatment strategy will look like and how we go to help you.
Amazing. And so are there any kind of common patterns of imbalance that contribute to
Sure. Yeah. You want me to dive
infertility?
into those two?
Yeah,
Those
if
are
you
great
don't mind.
examples. Yeah, sure. They're very relatable. So the kidney yang deficiency is almost like your hypothyroid looking presentation. The
Mhm.
woman tends to be on like the cold side of things, whether it's their whole body feeling cold or just their extremities feeling cold. They tend to have low energy, fatigue. They have a desire to lay down, not just sit down, but actually to lie down. And they have slow or sluggish digestive system and metabolism. They tend to have a low libido, which of course is not what we want for fertility. That doesn't help the cause either. And they tend to have problems with the luteal phase of their cycle. So the part after ovulation, from ovulation until your next period, if you're not pregnant, that luteal phase is when we want to see the body warming up and we want to see good levels of progesterone. But someone with kidney yang deficiency, yang is like the fire of the body. And if you don't have that warmth, then you're also probably low on progesterone and you're more likely to develop imbalance that we call cold uterus. And cold uterus is a very like poetic sounding thing, but it's very real. You will feel the cold sensation in your lower abdomen. You will have purple, thick, clotty periods with stabbing, intense, crampy pain and pretty bad PMS usually. And these women also tend to have long cycles. So when someone says my cycle is irregular, but it's always 32 to 38 days or even longer, I automatically start to assess them like maybe they're a kidney yang deficiency. There just isn't quite enough warmth and energy to power things up as efficiently and timely as the cycle should go. And then it leads to these other problems. So that's the basics. If you're not sure, you can also check your tongue for any of the patterns of imbalance. So for a kidney yang deficiency, the woman's tongue is going to be on the puffy side. So it's one of those big tongues when you look at it, and it almost always has even teeth marks on the sides, or scallops as we call them, because your tongue is so swollen that it's actually pushing into your teeth and causing marks on the sides. It's also probably wet looking, like just really wet looking for a tongue. And then it also is pale in color most of the time. So those are additional clues that we can see. Okay, this looks like a kidney yang deficiency person.
Mm.
And it's very common. It is very common. So we see that one. These two that I'll tell you are probably the two most common that we see. So then the opposite of a kidney yang deficiency is a kidney yin deficiency. So again, every organ is comprised of both the yang and the yin. And the yang is that warming part we already discussed. And
Mhm.
the yin is that more cool, nourishing, watery part. So when someone is deficient in the yin, they're dry, right? They don't have enough of that cooling water going on to keep things moisturized and lubricated. So this presentation is exactly the opposite. This person tends to be hot. And whether that's just like hot flashes, too early or too much, or their whole body is hot, their face can be all red, or just their cheeks will be red a lot. They get thirsty, especially in the night, in the evening. This will be the person that wakes up a lot at night and feels hot or thirsty in the night too, as they're having those night wakings. Their metabolism is just pretty high. So they're always hungry. Their hunger is high. They can always eat another meal. They get hangry if they miss a meal. They have a high libido, which is helpful for fertility. So these are not the women who are complaining about like low fertility or low libido. They're complaining about usually ovulation issues. So the kidney yin deficient presentation tends to give you problems in the follicular phase or anytime from your period through ovulation until ovulation. So when there's problems there, we don't have enough nourishment for the egg. Sometimes you might have been told things like you have poor egg quality, or you have premature ovarian failure, even, or your eggs just look older than you are, or your follicles don't develop nicely if you're tracking them with ultrasound prior to ovulation. These are all these egg quality issues, and these issues with ovulation tend to be from a kidney yin deficiency. And you'll know, you just feel dry. You might have actual vaginal dryness. Your bleeding is usually on the shorter side. Your cycles tend to be shorter. Maybe if someone says, my cycles are always 23 days, 24 days, I'll probably think kidney yin deficiency is the first place to investigate and ask further questions. The blood might even be scanty, we say, where it's just not a lot of blood, but that's not true for everyone. Some women with this pattern do have a full, angry, hot, neon red presentation. And that's because if they stay dry for so long, they actually get hot. They generate fire from that heat and that lack of cool, nourishing water. They generate so much fire that their blood can even be angry. And that's when they have just like deluge of hot, neon red colored blood. So
Mm.
sometimes it's too little blood, and then because of the dryness, and sometimes it's angry blood because that dryness has generated heat. Either one of those is normal. And also, when we look at their tongue, if they have a kidney yin deficiency, they tend to have a really small tongue, and it tends to be red. And it might even have little cracks, little transverse cracks, like horizontally all up and down the tongue versus that like longer center crack that we're more accustomed to seeing. So everything looks different. The temperature, the tongue, the metabolism, the period the cycles, where your problems are with fertility. These are very opposite counterpart type of imbalances. And because again, the kidney rules reproduction in general, that organ system and those two types that it can be imbalanced in, those really are the big place to start for us. There are a couple of other imbalances that have to do more with blood, like liver blood deficiency, that can also wreak havoc with your menstrual cycle and thus your fertility and the ability to nourish your uterine lining thick enough to grow a placenta and then another person out of your blood. So there are these other imbalances that can come into play that pull in other organ systems like that liver or heart for the blood deficiency. There are a few other ones too I could go into. Honestly, there are probably like hundreds that we could go into, but I know we don't want to do hundreds of imbalances. So the two main ones would be kidney yang deficiency, kidney yin deficiency. And then moving from that, the liver or heart blood deficiency is probably the third most common one. If
Mhm.
you don't have enough blood, you'll have a pale tongue. You'll have
Mhm.
low energy. You'll have poor memory problems. Your skin will feel dry and sometimes even itchy. This can present different ways with the period as well. If you don't have enough blood, you certainly won't bleed a lot. So this is the person that only bleeds for one day and then their period's over and they're always asking, "Can I get pregnant if I only bleed one day on my period?" And the answer for us is that maybe, but it's something worth checking into. If you're only bleeding one day, that blood deficiency could be leading to problems with both egg follicle nourishment and also the uterine lining being nourished enough to do those placental growth things that we
Mhm.
talked about. So that's a big one. And then if I get to pick a fourth one, I'd like to complete the circle here with the fourth most common pattern of imbalance related to fertility. And that would be a blood stasis issue. So when our chi and blood, our energy and our blood in the body get stuck, stagnated, they can lead to a lot of problems. So if it's just a light stagnation, like you're really stressed out and you feel all clenched up, that's very common, right? In our fast-paced modern society. We call this liver chi stagnation, where our energy is just not able to flow freely around the body and it can't then move the blood freely around the body to nourish all of the places it should. So when stagnation happens, it both clenches everything up tight and then it slows every function down. And then it makes it almost erratic. So when people tell me that they have really irregular cycles, like sometimes it's 22 days and then sometimes it's 42 days, especially if the period itself has one of those stops and then starts again patterns to it. So you bleed, stop a day, bleed again.
Mhm.
That irregular nature, people who track their basal body temperature, they will have charts that go, if they have liver chi stagnation, because of that erratic up and down nature of when your chi or your energy just cannot flow freely. It's fighting all the way there. And it's mostly caused by stress, especially emotional stress, especially in long-standing emotional stress. So people who have a lot of like childhood trauma or a lot of unprocessed emotions, they will easily develop liver qi stagnation. And the other ways that you'll know if you have this one would be PMS related. So during PMS, you're going to have a couple of specific things. One, irritability. Okay, that's going to be your emotional change. Irritability versus someone else who might be like sad or tired. You're going to be irritable. And secondly, there's going to be some breast involvement for you. So it's either going to be really like swollen breasts or sore breasts during PMS. Maybe even during ovulation, you're experiencing these two signs too. So these are big, like huge red flags for us that it's very much sounding like liver qi stagnation. And we don't like irregularity with the menstrual cycle. When we're trying to conceive, we want things to be very regular and free flowing and circular. We want to be able to predict, this is when I ovulate, this is how many days I have to work with. And when someone has liver qi stagnation, they can't predict things. Their ovulation tends to be moving around a little bit. Their cycle length is moving around a little bit. And they're having all these PMS signs and symptoms that make them not even want to have a good high libido and enjoy trying to conceive at all because of that irritability and that soreness and tenderness around the body. These people also tend to get headaches. And what's worse about this pattern of imbalance is that liver qi stagnation probably sounds bad enough already, but if it gets more long-standing, it worsens and even your blood gets stuck. So it's not just your chi or your energy that's stagnated then. It can become blood stasis, which is like 2.0. It's a really bad version of that. So it's all of that stuff, plus your tongue will actually look purple, or it will have purple dots on it, or red and purple dots. If you look under the tongue, those two veins under there, they're like fat, black, full of blood all the time. These are huge signs of liver blood stasis. And your period is going to be painful and it's going to have clots. So we define a clot as anything over about a grain of rice sized. So it's normal to shed your uterine lining. You need to have little flecks or grains of rice coming out. That's normal. But if you see something like bigger, like a grape coming out, or even limes in a lot of the women that I work with at first, that is not normal. We don't need clots like that. Okay, so that would indicate a blood stasis where things are getting stuck in there. Blood stasis is also the main root cause of things like endometriosis, fibroids, sometimes PCOS, although PCOS can be a combination of dampness in the body and some blood stasis. So that's the interesting part too, is that all of these patterns of imbalance that I've described, they don't stand alone, right? We've already seen how some of them can lead to the other ones, and some of them are opposites of each other. You can unfortunately have 2 or 3 or more patterns of imbalance going on in your body at the same time, especially because different organ systems can have different types of imbalances going on at once, and they can affect your menstrual cycle, your moods, emotions, your moisture levels in the body, your libido, everything about you all at once. So when I talk to someone, it's not usually that straightforward for them as to which imbalance they have. I've experimented with doing things like at-home self-assessments or take this quiz and see which pattern of imbalance you have. And it's just never that straightforward because we have mixed patterns and we have a combination of patterns going on. And that's where you do need consult a professional because it is a very complex thing. It's 3,000 years of tradition and of this medicine and this system that's developed. So there's a lot of kind of intricate ways that we can say which patterns should we go for first and which ones are more long-standing and which ones are going to be more stubborn to fix and decide how to tackle those patterns of imbalance that anyone has. But again, the good news is that all of these things can change. All of those things can be shifted and rebalanced. And then all of those symptoms and signs that I mentioned get to go away.
That's interesting because you answered my question, because in my head I'm like, can you have combinations of this?
Sure.
Because even I'm sure everyone listening, as you've been mentioning things, they're like, tech, yeah, I get that tech. Like, yeah.
Mhm.
So when you've been mentioning things, I was, yeah, I feel like I fit in that box there. But then when you're talking about kidney yang deficiency, but then when you're talking about the yin, I was like, yeah, but I fit in that box there too.
There's a really good reason for that too. So because each organ system is comprised of half yang and half yin, if
Mm.
one of those gets weak for a really long time, what is it ultimately doing? It's ultimately pulling down the other one too, right? So they can start to affect each other. So if you have one of those really badly or for a long time, it will ultimately start to pull the other one down too. And then you'll have signs of both.
There you go.
There we go.
So it is, you've just answered one of my questions. So really, you can have combinations of all of these, and you've already mentioned PCOS and endometriosis, and we'll dive a little deeper into all of this. So we're starting higher level here and we'll dig a little deeper, but you've already answered it's not just as simple as one or the other. You can literally have a combination of the two. And then it's not just the kidney thing, you can be incorporating liver, heart, blood stasis, all those other types of things as well. So someone can present to you, and it's not just a simple, and I guess this answers your last question that I asked you as well. It's not just like a simple Western type, yes, you've got PCOS. It's like, actually, yeah, you might be presenting with PCOS, but it's a little bit more complex than that.
Exactly. Yep.
Because the body is a really complex being. There's so many systems that interplay with each other. So when I think about that kind of singular diagnosis, it's almost like I can see that this makes a little bit more sense. You're dealing with a really complex system. So
Mhm.
sometimes the answers or the diagnosis or the patterns are a little bit more complex than just like a singular module like thing working in a silo over here. But you have mentioned a couple of things that I'd like to ask you, and that is about, you've mentioned qi, you mentioned yin and yang. So
Mhm.
can you explain their kind of roles in reproductive health?
Sure. Yeah. So we have these very important substances and natures of those substances in the body. And again, it's helpful to think of everything as like a pair or a counterpart so that everything is in relation to something else. So everything in our body, including our each individual organ system, including the uterus and every part of us, is a combination of yang and yin. So the yang is always the upward part that's warm and energetic and wants to rise up and go up and expand. And then the yin is the watery, cold part that just wants to like curl up and go down lower and sink to the ground and be nourishing and just cool and calm. So we've got this like hot action one that's yang, and we've got this cool, calm one that's yin. And when everything is in perfect balance, you have the right amount of energy and everything works the best and the metabolism is on point and your hormone production is perfect. But when there's an imbalance and you get too much of one of those, like too much yang, it will take over your body with fire. Then that's too much like movement and upward activity and fire. And then it will make that it look like you have a yin deficiency, like you don't have enough yin, enough cool stillness to your life. And you can affect these things greatly if you do burn the candle at both ends and you are doing workout classes 5 nights a week for 4 hours and you're just very much go. You can contribute to too much yang in your body, in your life, and then your yin will suffer, right? And the other way too, if you're always just laying around on the couch, just sipping ice water and laying down and sleeping 15 hours a day, and you're just so yin and so calm, there's not enough activity and there's not enough action, there's not enough yang in your life. And then you'll have other problems. That's what we think leads to depression and these other problems with fertility, not just mood, but that'll be kidney yang deficiency over there. Okay. This very like low libido, low energy person that's just laying down cold all the time. So it always has to be a balance between yang and yin in your body and in each organ individually and as well as overall. So the other parts of that are we can look more specifically at the things that are yang in your body. And the main thing that is yang in your body and in each organ system is your qi. So it's spelled QI and it's pronounced chi. And it basically translates to energy or spirit life or of you or something like that. So it's the upward, light, airy, moving part of you, the qi. And then the yin substance in your body is primarily your blood, this heavy, cool down thing. Okay. So it's like very yin substance. So we can talk about blood deficiencies, but they are oftentimes linked with a greater yin deficiency. And we can talk about qi deficiencies, but it's oftentimes linked with this bigger picture of a yang deficiency, but not always. So they're not the same. All blood is not just yin and yin is not just blood, but they are very similar. And all qi is not the same as yang and all yang is not qi, but they are very similar. So we usually talk about them in sets like that.
Okay, yeah, because I guess you're trying to, I mean, how many volumes are there? It's like a 3,000-year-old medicine. There's so
Yep.
many volumes and things that people need to know. And I completely understand that you're not going to be able to summarize everything in the podcast. And there's so many different complex interrelations in this. But I think that gives such a really good overview, I suppose. Now, you have mentioned the tongue in there a little bit. And, I go to acupuncture reasonable amount and they do check my tongue when I go in there sometimes. So how else you've mentioned a few things that they're looking at. What type of things would they look at and how else would you diagnose that kind of stuff?
Yeah, the tongue is, like I said, your body's report card. So it is absolutely a report of all of your internal organ systems and the state of affairs in each one. So
Mm,
we look at three things when we look at a tongue, and
mm,
all three of those can give a clue about what's going on with someone, especially
mm,
because our patterns of imbalance for fertility tend to be those very like opposite things. Like, is it kidney yang deficiency or is it kidney yin deficiency? Those tongues look exactly opposite. So a
mm,
lot of times we'll use the tongue as what we call like a tiebreaker. So if someone like you were saying is like, I think I have a lot of these symptoms, but I also have three over here, so I'm not really sure. Then we use the tongue to immediately break the tie and say, okay, you might notice those couple things, but your tongue says you're over here, lady,
mm,
So
mm,
first we look at the color of the tongue. So the
mm,
tongue should be a light red. It's different than dark pink, I promise. It's just supposed to be light red, and that's the perfect color. So if it's too dark, of a dark red or purple, that indicates either heat or stasis, like blood stasis or heat, something generating heat and stuck in there. If your tongue is lighter colored than that, like a really pale pink or even a very pale purple, then it's like a blood deficiency or a qi deficiency. So a light pale tongue is going to be deficient. A dark, angry red purple tongue is going to be an excess pattern. So it's giving us clues right away just from the color. And then
mm,
the second thing that we look at is the coating on the tongue. So
mm,
everyone's, first of all, tongue scraping did not really come from us. That's not our thing. I think it's from a different tradition of medicine, but we do not ask people to scrape their tongues because that's like falsely deleting all the data about your body metabolism. If you scrape your tongue, it's like changing the F to an A on your report card or something. So
mm,
we want to see the real coating on your tongue when you come in for any sort of visit. The coating should be thin and white and even and see-through and moist, but not too wet. So it's almost like not there. You can see right through it, but it still looks white somehow. So it's this very like majestic, clean frost almost looking on the tongue that should be just very even and light everywhere. If you have too much tongue coating and it gets thick and opaque and you can no longer see right through it to that nice light red color of your actual tongue body, that indicates too much dampness is accumulating in your body systems. Dampness is very dangerous. Okay. It doesn't sound like a bad word, but like to us, damp is a bad word because it is what cysts are made out of. It is what
mm,
tumors are made out of. So I had a ovarian tumor that had to be operated on emergency style the second they found it that day. It was because of my damp accumulation. My endometriosis was a combination of my dampness hardening into phlegm adhesions and combining with my blood stasis. These things matter, right? Dampness can be a very serious thing. If we look at the tongue and it doesn't have enough coating on it, by contrast, too much coating, dampness, not enough coating is another type of deficiency. Like your stomach isn't digesting enough to have any fluid left over to give you that nice mist to show that it was able to digest for you. So these are going to be your dry people because they have no tongue coating whatsoever. They tend to be those yin deficient people that are very dry and hot. And
mm,
that's, of course, more of those ovulatory egg quality problems would come into play there. And then the third thing we look at for the tongue is the body characteristics, if you will. Technically, I think it's just called shape, but it's like all the shapey things. So we want the tongue to be, when we stick it out, we want it to be relaxed looking, not like really rigid or deviated to one direction or quivering the whole time you're looking at it. All those things indicate things like wind and liver stagnation issues. We want it to be nice and firm, but not like floppy and flabby. That would be a qi deficiency or a yang deficiency again. And we don't want to see cracks. So everyone thinks that a tongue is supposed to have this like big crack right down the center. It's really not. If you have a big crack in the center of your tongue, it indicates a stomach deficiency. So when people come in for things like ulcerative colitis and Crohn's disease or gluten allergy, even like very specific stomach related things or digestive related things, they will tend to have that big deep crack in the center part of their tongue. If the crack goes all the way to the tip of the tongue almost, that's more of a constitutional heart issue and not really in the physical way. Like you don't have to go to the hospital if you see that right now. It's more of the emotional spirit way. So these people tend to either have had a lot of childhood trauma, a lot of emotional trauma in their past, things like that, or they're prone to those things happening. If you see it in a kid, they haven't had those experiences yet. I mean, unfortunately, it can be an indicator that they tend towards more of the emotional disorders later in life. So we don't want any cracks in the tongue. Those little transverse cracks that I mentioned at the beginning that go horizontally and they're shorts just all over, that's again more of your kidney yin deficiency, which would be some of those egg problems and ovulation problems and the short cycles. So the tongue is really truly a full report card of everything going on in your systems. Beyond those three basic areas, we can also further refine that by looking at what area of the tongue these things are appearing on. So is there too much coating only in the back? Then that's too much dampness accumulating in your reproductive organs and in your large intestine, your colon. Is there too much heat, red dots only in the tip of your tongue? Is just the tip of it fiery red? That's your heart. That means you have emotional heat built up, and the emotional problems are possibly contributing to your conception, or your struggles with fertility have been so emotionally taxing that now they're causing you these emotional problems. So your heart will have the tip of your tongue, which represents the heart, will either be very red or have red dots all over it. So where it matters, where it happens on the tongue, absolutely further reveals what's going on that's throwing off your fertility and your health overall.
That's incredible, isn't it? And I have no doubt in my mind that everyone listening to this is probably either like in the mirror at home at
Right?
the moment,
Grab
looking
it.
at their tongue. And if not, they will be going there very soon. Now, are there
Mhm.
other ways to assess your patterns of disharmony? Is that what you just
Imbalance is what we say.
imbalance? Yeah,
Yeah,
yeah.
disharmonies. Mhm.
So how else would you assess? So you've got the tongue, but I'm sure I know that I've had my pulse checked before.
Mhm.
So how else do you assess the patterns of imbalance in people that come to you with infertility issues?
Sure. Yeah. So it's really a combination of everything. The classic way is to use the tongue examination
Mhm,
to feel the pulses of the person and then to ask them what are called the classic questions. And those are those
mhm.
things I mentioned at the beginning that really span your whole body, like everything inside and out: digestion, sleep, moods, emotions, thirst, appetite, urination, everything really. And then all of your answers to all of those questions start to add up in this pile or in this pile, as you saw. So
Mm,
that gives us a big clue of what organ system is implicated and what types of problems it might be giving you. When I'm working with, which is mostly all I do nowadays, is fertility, I ask a lot more questions than the average provider would about the period. So everyone should be asking everyone about their period if they have one, because it gives so much information about their organ systems and functions. But
mm,
when you're working with people who are actively trying to conceive, we want to know even more about your period and your cycle so that we can further refine exactly where your imbalances are. And that's where I start asking really detailed questions. I want to know not just the length of your cycle from day one to day one, but I also want to know how many days you're bleeding. I want to know if there's any brown spotting at the beginning or the end. I want to know if there's any stops and starts days in the middle. I want the color of your blood, very important. The thickness and viscosity of the blood. Is it goopy and mucousy and clumpy? That's dampness. Is it really watery? That could be a chi deficiency. So every little detail matters, and
mm,
every color and clot and consistency and amount of bleeding all matters. The signs you have before PMS being really bad for you is an excess condition like liver chi stagnation or liver blood stasis. If your problems tend to be while you're bleeding, like your main problem is just fatigue and you're so tired when you're bleeding, or you get headaches after you've been bleeding for just a couple days already, that's when you get a headache. That tells us that you're a deficiency person. You have deficiency patterns. So when things happen also completely tells us, is your migraine before your period starts or after you've been bleeding for a few days? Everything matters. And then pulse taking, like you mentioned, is also Important to some providers. I know some practitioners don't take people's pulses at all. I've gone back and forth in my practice over the last 10 years of really taking people's pulses all the time, and then sometimes not really feeling like it was changing anything I was doing anyways. So not always doing it. But the basics of pulse taking for us is that it's not one pulse. So we don't look at a clock or time anything or count anything really. And it's not one spot. It's the 3 positions under the wrist crease. So we take the pulse with 3 fingers, starting at the wrist crease going down. And each one on each arm actually is a different organ system. So you can check everything from the heart and the liver and the one kidney to the lungs and the spleen, stomach, and the other kidney by checking these 6 positions on the wrists. And really what I have people do when I work with them virtually or in an online format, and I'm not physically there to check their pulse, which is now most of the women I work with, is I have them just feel gently themselves. So if you just take one hand and lay it across your chest, and then you reach up and over that with the other hand,
Mm-hmm.
I ask them just a few questions. Did you find it yet? Or are you still repositioning to try to feel it? That tells me a lot. If you feel it right away and you feel it under all 3 fingers, that's probably an excess pulse. That's a big pulse, right? If you found it right away and you feel it under all 3 fingers, and if you drop your pinky, you can still feel it. If you scoot down your arm, you can still feel it. These are excess signs. Okay. So your patterns of imbalance might be more on the excess side.
Mm-hmm.
If the person's, I still can't find it. I'm still, hold on. I don't feel anything. Or they're like, oh, I think I feel it under this one fingertip. This points to more deficiency, either a blood deficiency or some other deficiency where the pulse can be hidden or deep or something slow. So just these general questions give me a ton of information. Is it like a fat worm bursting to get out? Or is it like a thread that you feel deep only when you push? So the pulse can tell us general things like that, even in an online format, even over the phone even. It
Mm.
can be helpful. And again, like the tongue, maybe it's not going to make the determination for you, but it can be a great tiebreaker if you are between a couple of different patterns of imbalance and you want to know, where's the best place for me to start intervening? Is it going to be this pattern of imbalance or this one? What's
Mm.
mainly their main issue, or what's their biggest problem?
Mm. That's interesting because I've obviously, as you're talking, I'm taking down notes. And one of the things is like, how do you know which ones to target first? So I guess that answers that question.
It does answer the question in that we need to know where someone's main bulk of their problems really is. Is it a
Mhm.
lot of excess problems, or is it just all these deficiency problems? And the trick
Mhm.
can be people who have deficiencies for a long time allow the excesses to build up by default. So even when we see a lot of excess patterns, we know that ultimately it could have been a deficiency problem that allowed the excess problem to develop. So
Mhm.
we've learned that the body likes to handle problems in a very specific order. So if you just start throwing the spaghetti at the wall, like you said, and I say that as well, and see what sticks, you can get lucky. And that's why some things work for people. And then you'll tell your friends, like, I took this tea or the supplement, or I got acupuncture and I was pregnant the next week, or whatever. And then the other person goes to do that and they do those same things. And maybe they both have the PCOS diagnosis and it doesn't work for that person. And it's because that person's patterns of imbalance were not the same as the first person's. And this really, I think, frees people to understand why they may have tried something and it didn't work for them. It's not that even it was the wrong thing to try. It can just be that it intervened at the wrong place in their order of operations, if you will. So if they have all of these excess patterns of imbalance, like dampness accumulating in all their organs, their uterus is just like this damp phlegm mess, right? Like my uterus was a damp phlegm mess, so I can speak from experience. And that damp phlegm accumulated in different ways, like cysts and then a tumor and then endometriosis when it combined with the blood stasis that was also going on in my uterus and in my reproductive system. Then you had to figure out that what I didn't figure out in time 20 years ago was that things that I was trying weren't working as effectively as they could have because I was doing things in the wrong order. So I went in
Mhm.
there just trying to move blood rapidly, right? Like massage is going to move the blood and move it all out of there. But what I didn't know was that if you try to move your blood stasis before you've cleared out all the damp goo sitting around everywhere in the blood, it just further flings the goo around in your body, and then you have damp everywhere, and it's like a dampness thrown in the blender, and then it just spread all over my body. So then I'm
Mhm.
having cystic acne coming out on my back and my chest and my face because I've been just spewing the dampness all over from my reproductive organs where it was nicely contained to all over the rest of my body when I started trying to move that blood stasis. So what we know now, and what I now center my entire practice around, is to respect the order of operations that the body needs us to work in. And it sounds maybe not important, or it sounds like somebody just arbitrarily decided that one day, but really it's very meaningful, and it makes a lot of sense when you think about it in terms of like, you could be someone who is walking about your day and you cut your hand. Immediately your body is going to be like, "Ooh, that's the newest thing. We have to prioritize that. I'm going to go fix the cut on your hand for you right now, person, and save your life," right? We don't want you to bleed out and die today on the sidewalk because you cut your hand. So all of your body's attention kind of times out everywhere else and then goes and fixes that one thing. Once that one thing is fixed, then your body's, what were we doing? Oh, making progesterone. Okay. And then it goes and it's, okay, now I can make your progesterone. So we know that the body does prioritize what it wants to heal first and what it wants to do next. So it's the same thing as that, but on a way bigger scale, where it's like, we are not going to fix this cold uterus until you clear out the wind damp that's inflaming your uterus first. So
Mm,
it can be in any pattern of imbalance we can apply this model to. But the
mm.
important part is that when we tackle your imbalances in this very specific order, it works way better. Your body is, yes, this is the way I need to work in. This is when I needed that supplement, not a year ago. I couldn't use it to help you a year ago, but now that we've done these other things, now when you take that supplement, I can utilize that and we can make good things with that body.
So you've mentioned an order. What order should we be looking at these things in? Are you allowed to tell us? Can you tell us? And
And to
what would this
summarize
order be
that,
called?
sorry,
What would this order be called? Is there a name for it?
I call it the order of operations. I think
Mhm,
it's very mathy to say it that way, but it
mhm,
just makes sense. There are things that we should do first. And the biggest and most important part of that is clear your excess out of the way
mhm,
before you start to nourish your deficiencies. And that's a huge common mistake. When we see someone with both deficiency patterns and excess patterns in practice, we want to get in there and we want to help everything at once. We're like, I'm going
mhm,
to clear this excess one and move this blood and get this damp out. Meanwhile, I'm going to be tonifying your chi and warming your yang, and I'm going to do all these things all at once for you. And that's how most acupuncturists attack their patients with their needles the first day. They see them, they're like, I see all your patterns, and I'm going to treat all your patterns today, and you're going to feel better in every way from their first visit moving forward. And that, again, you can get lucky sometimes, and that can work because it might happen to address that person's patterns of imbalance in the right order, but you really don't know if you treat it that way. So instead, by focusing on clearing out their excess patterns first, then going on to supplement their deficiencies, we see so much better results, just in incredibly different amount of results and better results with people, and not just in fertility, but in any health condition at all. That seems to be the effective order of operations. Again, if you jump to the later ones without doing the beginning ones, it just stirs your problems up. And it just really just clarifies to me, when I learned this way of doing things, really clarified why things were working for some people and not for other people. They have the same condition. Why wouldn't the treatment work for both of them? And that's very Western medicine, right? You have a
mhm,
diagnosis or you have a marker in your lab work. Here is the treatment for that. It's one thing, almost
mm.
always the same for everyone. And then it just what works for some people and it doesn't work for other people. So understanding this order of operations and how we need to intervene with the body and its systems is really the game changer that makes the way I now treat my patients in office and the way I do fertility coaching in my online group now. It's completely different. And it's what's getting our results. It's getting such great results. Yeah. Is that change?
Amazing. Now, I know you've mentioned the 5 body stages. Is this what you've been explaining, or is that different?
This is what I've been explaining. Yep.
Okay.
So all the imbalances that can happen are generally the result of one of these types of pathogenic factors or imbalances in other ways. I've probably mentioned all of them at this point, but they can be things like wind inflaming the body.
Mm-hmm.
And wind really moves things around. So if you have problems that come and go or that suddenly come on or that move around the body, people that have pelvic inflammatory disorders or diseases, that really flares and goes away sometimes and comes on quickly. That would be a wind thing for us. Dampness is another huge pathogenic factor that leads
Mm-hmm.
to imbalances in the body. So dampness comes usually from your gut,
Mm-hmm.
and it comes from drinking cold beverages and eating greasy foods or raw cold foods, things that just slow your digestion down in one way or the other. And once your digestive function is slowed down and sluggish, then nothing else works very well in your body. All of your metabolic processes are just like in the basement after that. So dampness is very heavy and very down bearing. When people come in and say that they feel like when they have their period, their uterus is like falling out. Basically, they feel this down bearing sensation with their cramps. That's usually a dampness issue with this down bearing sensation.
Mm-hmm.
So dampness is huge. We have to get that out. And whenever people are talking about gut health, this is where we address gut health. So the beautiful thing about traditional Chinese medicine, which is what we acupuncturists are practicing, is that it literally addresses everything in one order now that everyone else is trying to address separately. So inflammation is a big deal. You're right. If you think inflammation is the root of infertility, you're right. It is part of it. And that's what we do first. We get inflammation out. And for those people who are out there like pushing supplements for the gut health, right? Gut health is the root cause of infertility. You're right too. It's a part of it. And it's the next part of it. So now it's time to address your gut issues and see if you have dampness in there slugging down your processes. And then after that stuff is all out of the way, then we can see how well your chi is moving. So if we then look at your chi stagnation, and if you have that liver chi stagnation pattern with the PMS, with irritability and the breast tenderness and your stops and starts period days and your irregular cycles and basal body temperature up and down, that kind of stuff, it has to be free flowed. So once the gunky damp and the windy inflammation is out of the way, then we can effectively free course your chi and move the energy around through your body safely. And it won't be blowing your wind around everywhere and inflaming other parts of you and moving the dampness out. And now you have acne everywhere. And now you have yeast infections because we've moved your damp before it was ready or after it was ready. It's got to be done at the right time. And if we move these things out of the body in the right order, we don't get so many of those side effects or those like healing responses, people call them now, or it's part of the journey. It might be, but you're going to have a lot more of them if you do these things out of order. If you do the things in order, then that's how our body wants to handle it. And it's familiar with handling it. And it doesn't have to give us those like healing reactions or those uncomfortable side effects of healing your gut or getting rid of your inflammation. And when we work on chi stagnation, that really overlaps a lot with this newest thing that I'm seeing all over Instagram and TikTok, which is your nervous system is dysregulated. And it's, yes, you're right. That is also part of it that we're also dealing with for the last 3,000 years. So anytime that there's like a push of influencers that they've found out what the cause of infertility is, or like they've got the answer and it's this one thing or this one body system, we've already got that covered. It's already part of what we've been doing for 3,000 years. We just are calling it different things. So it's like fun to see modern doctors or influencers, either end of it, discovering these things again. And we're just like, yep, that's correct. That's what we're doing. You don't have to do just that one little part either. You can do it in this whole nice holistic picture where it addresses all of those systems, from the inflammation to the gut health to nervous system regulation to finally the blood circulation and your cardiovascular health, which is something that they don't really scream about right now, but who knows, maybe that will be the thing next year that's trending. Like blood circulation is the root cause of infertility. And it's, yeah, yes, it is. It is also one of the parts. So we're going to take care of that as well in the right order so that your blood is flowing freely and it's not bleeding. You're not bleeding too much or too little. You're not having stabbing cramps with your bleeding. You're not having purple blood that's all backed up or brown blood that wasn't effectively getting out on time. So all those things matter and they all can be resolved and improved, but it just works so much better when you do it in that order. And the main problem with this order is that the last step is when we finally see what someone's left with. After we've cleared out all these excess problems, Now it's just you, right? We've got all the pathogens out of the way. All the hidden pathogens are gone. All the imbalances that were too much stuff in you, gunking you up, those are gone. Now it's like you, bare bones. And we can see, does this person have true deficiencies that need help? Usually we can balance and nourish those things with foods, certain foods that will address whichever deficiency you have. We have different food lists for those individual imbalances. And by eating a lot more of certain foods that raise those deficiencies up to the good level, that's usually enough. If there's still a deficiency that's very pervasive, maybe it's like your genetic constitution that you are always going to be prone to a chi deficiency. Then, even after we clear all these excesses out, we've given you food lists to eat so much more of these types of foods that raise your spleen and stomach chi, your energy of the body. If you still need more help, that's when we can do a supplement that's supplementing your stomach health, right? To help your digestion. But that is last. And that is something that people want to do first. So if you ask people what they've tried for fertility, it's always going to be, I took this supplement and this supplement, and it's usually a pretty long list of supplements these days. And then they tried these fertility teas and they tried XYZ things that they saw online that some worked for someone else. And they did it at the beginning instead of doing it at the end, when it really is a time that works for your body, and that your body can actually say, oh, thank you for dumping all those probiotics in here. Now that my stomach is clean, I can actually let them colonize and let them do good work for you, versus when you dumped them in 6 months ago into a pile of damp gunk and they weren't really able to do any good for you.
That's so interesting, isn't it? Wow, that's really incredible. So basically what you're saying, and I think we'll go into this a little bit, but I guess what you're saying is that the order in which you use the different modalities, and you've probably got a word for this in Eastern medicine, but the order that you're treating them in, what modalities you treat them with, directly correlates to what stage they're in, rather than just because I think a lot of people think Eastern medicine acupuncture rather
Absolutely.
than
Yeah.
actually, hang on a second, it's this multi-layered, like multidisciplinary avenue of health. So we've talked a little bit about nutrition, you've brought up supplementation, obviously there's acupuncture. What other ways of treating the patient are there?
Yeah, so you're right on. We have 5 main modalities or types of treatment strategies or therapies that we utilize with each person. Because it is a 3,000-year-old entire system of medicine, there is something for every problem and something for every person.
Mm,
And each practitioner, depending on what school you went to and what school of thought that school was teaching mostly, you're going to end up with very different acupuncturists or different practitioners. And that doesn't just mean by country or by state or even by city. It's very different. Every acupuncturist you go to will probably do very different things to you or with you. Even if you just get acupuncture needles, the points that I would choose for someone might be completely different points on the body than my colleague would choose for that same person the same day. And they both probably work well because there are so many strategies that we can employ that utilize the treatment strategies from all across traditional Chinese medicine and other East Asian components of this medicine that have become part of the tradition together over the 3,000 years. It gives you so much to choose from, and there are so many different styles worked in there. So we have the 5 main branches or modalities. So we mostly talk about acupuncture. And that's the one people know about, and that's what
mhm.
most of us are called. So my license in the state of Illinois in the United States is acupuncturist, a licensed acupuncturist. But my education, my master's, my doctorate is in a bigger system than just needles, right? So we're drawing from this entire system. It might be called Oriental medicine or Asian medicine or East Asian medicine or traditional Chinese medicine, depending on the school that you went to. But it's going to teach you all of these things no matter no matter what. So acupuncture needling is the first one, the one that everyone knows about. And this can also be accomplished with acupressure. So when I work with people virtually, the way that I substitute the acupuncture needles is just simply by having the person massage that same acupuncture point with acupressure instead. So that's a big one. And that is a huge part of everybody's kind of plan, right? When, especially for fertility, when we need to balance so many systems in your body to make it all work together, acupuncture or acupressure is a huge part of that. And then secondly is food modification. So food therapy is arguably my favorite part. If you're allowed to pick a favorite treatment modality, mine is food therapy. So food lists are going to be 2 usually for each person at each time for each imbalance. I'm going to work with you and I'm going to say, I need you to eat more of these foods and I need you to eat less of these foods. And this is very individualized. So we don't have a concept that's like, dairy is bad for everyone, or dairy is bad for fertility, or everyone should eliminate wheat. No, I recommend wheat for some women trying to conceive if they are yin deficient, because wheat is very yin nourishing. Similar thing with dairy. If someone has a lot of dampness, they're going to have dairy on their no list. Please avoid dairy, right? That's because they have excess dampness. That's not because they're trying to conceive and it's bad for fertility. It's great for fertility in general, but not for people with excess damp imbalances. So for each person, depending on what patterns of imbalance they have going on at that point, they're going to get a list of foods that are like their medicine, right? Every time they eat more and more of these foods, it's just helping resolve their imbalances. And then they're also getting that list of avoids, which is every time you eat these foods, it's worsening or aggravating your particular imbalances. So they're very individualized. And because your patterns of imbalance hopefully resolve and change, then your food lists also change. So food lists are really fun because if I tell someone to avoid all their favorite foods, I get to also say, don't worry, it's temporary. You can get back to them later once we've fixed that problem that you have.
Yeah.
And then third is herbal formulas. So we use herbal formulas. Many of them are classical formulas that have been developed thousands, if not hundreds of years ago. And they've been so much trial and observation. You can't ask for richer data than that. So we know that the ways that the herbal formulas work together, they're very modular. Like we don't do a lot of single herbs or single supplements. We're not the tradition that's going to say like, you need to supplement with magnesium or you need to take vitamin B, whatever. Like we don't really do that in chemical isolates like that. We're very much more whole foods oriented. So our herbal formulas are going to be like ginger root and white peony and fried licorice, like this formula of real whole food parts that's been condensed together and then encapsulated or in a liquid alcohol solution. A tincture is a really common way for us to use these herbal formulas. And because they're not like blanket supplements, like I'm never going to say, if you're trying to conceive, use this herbal formula. That's not a thing. It's what's your pattern of imbalance? And then here's the herbal formula to fix that. And then in a month, you don't need that anymore because we fixed it, right? So we're either not going to take an herbal formula or you're going to take a different one. And there's different strategies around how long to take them. Some practitioners break it out over the cycle, the menstrual cycle. So you'll take this one herbal formula to help your follicular phase and another one to help your luteal phase. So again, there's so much variance in the practice that your experience with herbs or herbal formulas might be extremely different from practitioner to practitioner. And then the fourth one, I like to call it, these last two, they get a little, everyone will say a different thing right now, probably. So I say the fourth one is like breathing. And breathing techniques has to do a lot with things like meditation and intentional breathing. And it has to do with that chi regulation and calming the nervous system a lot for me. That's the way that I bring that in. And then the other one is movement for me. So this can encapsulate classic things like qigong movements and tai chi movements, where you're cultivating qi and you're doing these specific exercises that can engage different acupuncture channels in the body and help a specific organ. But it also, in modern practice for me, has expanded into which exercises are appropriate for you right now, trying to conceive at this point in the month with your patterns of imbalance. So I don't tell everyone, no one can run if you're trying to conceive. But I do tell a lot of women with kidney yang deficiency and qi deficiency that they shouldn't run when they're trying to conceive or in pregnancy, because their body is already struggling to hold things up and in. And if you're going to run all the time, it's very down bearing and compression oriented, and that can make things fall out. And that's not what we want, right? Similarly, people with yin deficiencies and blood deficiencies, they barely have enough. And now you want to make a new person out of that amount. So you should not be going to the gym 5 days a week and doing high intensity training and just like burning through your very small, precious reserves that you have of yin and blood. So everybody's exercise and motion, body movement needs to be different. And it also depends on your imbalances, whether or not you're trying to conceive. If you have a lot of the blood stasis, there is an appropriate time to move that through body work, like massage. but not always. We don't want to do that too soon if we haven't addressed these other things first, like getting the wind inflammation out and getting the damp gut healed first.
Mm.
So it's still, all of these things will be employed no matter what your pattern of imbalance is. It's just that the acupressure points will be different depending on your pattern of imbalance. The exercise types will be different depending on your pattern of imbalance. The herbal formulas will certainly be extremely different. Food choices will be very different. So we'll use all of these modalities, but differently for each person and each imbalance.
Mm. So amazing, isn't it? Like, I just love the individualization of this. And I guess what's coming to me is a couple of things in terms of, I would imagine that it would be much better for someone who is thinking about starting a family to address this stuff before they genuinely like start trying,
Oh, yeah.
rather than waiting a little bit until they're finding issues or they're 6 months down the track and nothing's happening for them.
Mhm.
So then I guess the next question I would ask around that is like, how long is this process that we're talking about? Or is that again an individual thing based on what's actually going on?
Yeah, I hate every answer having to be like, "It depends," and it's
Mm,
different for
mm,
everyone, which is the actual answer, but of course, I can try to give more estimates and some examples to help it become more real. And you also spoke to one of the great ironies which is that most people don't find out about acupuncturists being able to help for fertility until they have been struggling or they have gone to a fertility clinic, which in the USA right now is if you've tried for a year without success, then you get to go to a fertility specialist usually. So at that point now, thankfully, many of them are recommending because of the studies that do exist that show things like acupuncture around your egg retrieval and embryo transfer for IVF, almost double your success rates in some cases in some studies. So that is getting out, the word's out. And so now we're getting referrals at that point. But you're right. If they would come in earlier for preconception care, that would make a world of difference. And especially in their stress levels, because they could have avoided so many agonizing months of peeing on sticks that did not turn the right color and going to all these appointments and being told that there's something wrong, but they can't find anything wrong. And it's a very agonizing, stressful process for many people. So by engaging in preconception care when you're just starting to think that maybe you've been on birth control pills maybe and you're getting off of them and maybe you're not ready to start trying yet, but you want to get your hormones balanced and make sure your cycles are getting regular before you want to start trying. That would be amazing. That would be so ideal. And
mm,
the key here is that fertility is simply a marker of health. That's it. So there's no special treatments we do for fertility. It's just your health. That's all we're trying to do with all these 5 branches of treatment, these 5 modalities. Everything we're doing here is just optimizing your health, which then by default optimizes your fertility. So regardless of what you came in for, everything wrong with you is probably going to improve by default. So that's really fun when people didn't ever tell you they had problems with sleep or migraines or digestion. And then after you've been treating them for fertility for a month, they casually mention that all those other problems are gone. They could have had that relief years ago before trying. So the other part is people ask me that exact question all the time, like, how many treatments do I need to do? Or if they're already engaged in an IVF active cycle, they say, like, when do I need to come in? And it's so hard because I don't want to say you're late. You should have come in 2 years ago because that's no one lives in ideal. That's just ideal. So everyone in the real world is, I'm already doing it. So I say, then get in here as soon as you can because every treatment helps and the more the better, truly. There's no such thing as like too much. We can't do
mm,
too much because we're just balancing and harmonizing.
mm. It's amazing. I guess I love the idea that your cycle is your monthly kind of health report card. So
Yes.
what's going on with it is literally your report card on where your health is sitting as a woman anyway.
Absolutely. And that's why we just never have for 3,000 years utilized or needed to rely on blood work or lab tests of any kind. So your hormones are just markers. They fluctuate daily. They are indicators of a bigger thing going on in your body. We're always, and always have been, just going after that bigger thing in your body that's making your hormones either be too high or too low in this way or that way. We see correlations sometimes, of course, in modern times. Like we know that a kidney yang deficiency tends to correlate with a progesterone deficiency or low progesterone in many women. But there's other things that are looser correlations and that we just don't need to look at, honestly. If people bring me their lab work, I'll look at it. It's interesting, but it's never going to change the way that I would address it. It's never going to change your pattern of imbalance because one of your hormone markers was this today and that yesterday. It just doesn't matter. And it, in fact, is very stressful for people to continually have to go to these appointments and constantly test all these markers, and where their thyroid marker is and where their progesterone is it's adding to their stress, and it doesn't have to be.
So speaking of stress, so when it comes to like emotional and psychological factors, how do they play a role in infertility when it comes to Eastern medicine?
Ooh, they play a really big role. So each organ has an emotion associated with it. So when we look at what emotion someone has a lot of, that will start to impact that organ negatively, mostly. So for example, if you're angry, frustrated, irritable, resentful, you have unfulfilled desires in your life, that is going to hurt your liver. All of those are liver or emotions. So they will go to your liver and they will stagnate, and you will start to get this sore feeling under the rib cage on one side that comes and goes, and you will have those irregular cycles and bad PMS. That's because the emotions have stagnated your liver chi. There are other emotions that are going to affect other organs. Okay, so the kidneys, which are so important for reproduction, as I've been saying, they are mostly affected by fear. So when women are, or when couples are, I work with men too, in many of these cases, when someone is very fearful or they have very long standing fears or deep seated fears, that can lower their kidney chi and affect their reproductive function. Absolutely. The heart is related to joy, or depression is what we now call it, but it's called lack of joy traditionally. So joy or lack of joy in your life. And if someone is very depressed all the time, they don't have joy in their life, their heart will suffer. And again, anytime I mention an organ name, we're not using the physical organ most of the time. We're using the functional organ. So we put a capital letter on it and to signify, like when I say capital H, heart, all the time when I say heart, it means the heart's functional system. So that includes like your spirit and your emotions and joy in particular. So when someone has heart imbalances, that can affect fertility. So the heart is responsible for sending the blood down for conception through something called the conception vessel that runs down your midline in the front. And if your heart blood gets too low, you will have these other problems like trouble falling asleep at night and being easily startled and all sorts of motion sickness, weird things. But fertility wise, it will affect your bleeding and it will affect your ability to nourish your uterine lining and build a placenta. So you can see that each different emotion you have affects a different organ. And sometimes there's kind of two. So I mentioned several for the liver at the beginning. The kidneys are affected by fear, but also sadness is the emotion of the kidneys as a result of it. So if somebody feels like their emotional change every month is sadness, that again is an indicator for me that it's a kidney deficiency, a kidney imbalance that's causing them to be sad every month with their period, their PMS emotion. I think those are the main. Let me mention one more because it is something that we haven't talked a ton about, and it's actually probably the most common pattern of imbalance in women generally, not just those trying to conceive. But there's a pattern called spleen chi deficiency. And the three symptoms for spleen chi deficiency are you're tired, you're bloated, and you have a loose stool. So this is almost I shouldn't say everyone, but this is extremely common in modern women. It's exacerbated by stress. It's largely related to diet. People who drink ice cold beverages like iced coffees or ice water all day now with their giant ice water jugs they're doing. If they do juicing or smoothies because they think that's healthy. All of those things just kill your spleen chi, kill your metabolism, just tank your energy to the basement. So your stomach only wants everything coming into it to be hot and warm and cooked. So anytime you're putting anything in your stomach that's not hot and warm and cooked, beverages and foods, it's just lowering digestive function and lowering metabolism. And then you end up with fatigue, loose stools, and bloating. So it's a terrible and terribly common pattern of imbalance that's mostly influenced by diet. And it leads to problems with your cycle, like spotting is one of the key early indicators. You'll be the person who has pink or red spotting throughout your cycle, especially in your luteal phase. So after ovulation, if you notice spotting there, that is spleen Qi deficiency is probably the cause of that. It can also lead to dampness accumulation. So when your spleen Qi is low, that's like all of your digestive power is your spleen Qi. So we want it to be warm and functioning. And when it's not, when it's all cold and wet from your food and drinks, then it doesn't have enough power to burn off the gunk or dampness from what you're putting in. And it just accumulates in your body. So you'll get overweight, bloated, heavy, slow, sluggish, low motivation, all that stuff. That's dampness starting to accumulate in the body. And you might see it by that thick tongue coat. You might see it with cystic acne. You might start getting frequent vaginal infections, yeast infections, or recurrent bacterial vaginosis, or just too much white discharge all month. All these things are signs of dampness. Your cycle might be, or your blood might be that like mucousy, thick kind of blood from the dampness that's accumulating. If you have PCOS with cysts, because not all types do, of course, the cysts in general are damp accumulations. And it also blends with blood stasis sometimes to make endometriosis and endometrial adhesions. Fibroids are damp accumulations. So anything that you have that's too much, that's not supposed to be in there, is probably a damp accumulation. So those big excess patterns that can be so serious, they ultimately arose because of your spleen Qi deficiency. So that is a big common pattern of imbalance that we didn't go into yet. And its emotional connection is worrying or thinking too much. So overthinking is the ancient term or the classical term. Today's term is anxiety. So when we're anxious and we're overthinking, like the type of anxiety that looks like this, and your mind is racing at night and you're just overthinking and worrying about things, that is what damages your spleen Qi, just as much as an ice water and a raw salad will also damage your spleen Qi and lead to all those things. Worrying too much is the emotion that causes that.
It's amazing, isn't it? This is all so fascinating to me. It really is so incredible. And there's so many layers to it, isn't it? It's really blowing my brain here a little bit. And I'm so invested in this. I've told you that before. I'm like, wow, this is so interesting. You've made me want to go down this path, not for anyone listening. It's not for fertility reasons. It's for my overall health reasons.
Right.
But when it comes to that, and I'm going to go off on a bit of a sidetrack here. Um, my age, so at my age now, fertility is not really something that I'm thinking about, but I definitely think when it comes to your overall health, and I think this goes to anyone listening, if you're not in that fertile kind of wanting to have a baby window, it doesn't mean that you can't go down these paths of venturing down these paths, because when it comes to your overall health, what you're talking about in general is your overall health. We're talking a little bit more specific around fertility and infertility, but your overall health, if you go through this, is obviously going to improve, which is going to improve all aspects. So if you're young and you're not thinking about going down the conception path, this is obviously going to tick all the boxes when you do. If you've maybe moved through that aspect of your life, we also know that there are other big hormonal shifts coming up that impact your hormones and impact your health. And if you address these other aspects of it, then that's going to make that better down the track as well. And then if you are in that fertile window, and I guess this is where this thought process came from in the first place, is that doing all of this stuff is 100% going to help your egg quality and your chances of conception and all that type of thing. And the reason why I'm having this this train of thought is because I was having a conversation with someone just yesterday about, because I have a belief that the whole age thing, yes, of course, as we age, our egg quality is going to decline. But at the same time, our overall health and well-being is such a huge contributing factor to egg quality.
Mhm.
We can't ignore that. So you can be an amazingly healthy 40-something-year-old that has gone through all of this stuff, that goes down the conception path and actually doesn't have the same worries or roadblocks and barriers as someone that's in their early 30s and is not that healthy and has poor egg quality and a number of other things going on and is facing many barriers and roadblocks.
Right. Age is not one of the first few questions that I ask someone who's coming into my fertility coaching group or in practice. It's in the list somewhere, but it's not that important. Most of the women that I work with do tend to be around 40. I've certainly worked with people 40 to 45 is a very common age bracket for me to have successful results with. That being said, I luckily now have some that are in their 20s that are doing just what you were mentioning. Like they are aware of preconception care now being a thing. They've heard the staggering statistics about how 1 in 5 couples now needs assistance to reproduce. And that men are 50% contributors now, which was not really commonly known prior to these last couple of years. And then we know the sperm counts are declining by 10% each decade since the 70s. So the word is getting out and people are becoming very much more aware now suddenly that if they want to reproduce, it's going to take a little bit of going against the grain, against the mainstream, because the mainstream food supply and stress levels and environmental exposures, that's what's caused all of these problems. So if you don't want to be in those statistics, people are getting the word that it is a lot about lifestyle changes. And that's why a lot of what I do in my fertility program is lifestyle changes. And that's why I shifted to what I call coaching now, because you can't do this stuff in a 1 hour visit with needles. That's great. But people need a lot of help with lifestyle shifts and reducing their hormone disruptor exposures. And so that's why it's such a long-term coaching agreement now to really make a difference in someone's life. And I don't like to talk a ton about this because I'm really trying to allow myself to specialize and to really focus on fertility like I've wanted to for many years. But I also get a lot of women in perimenopause coming to me and they're like, I have a lot of things you mentioned. What would you do for me at 48 with those issues? And I say exactly the same thing that I'm doing with that 26-year-old for fertility who has that same imbalance. Because what you do with fertility, what imbalance is causing your challenge with fertility is the exact same imbalance that will cause your perimenopausal symptoms. So I can tell you right now, when you're struggling with fertility when you're 30, let's say, I can tell you what your perimenopausal symptoms will be. I can tell you if you'll be like the hot flash dry person or if you're going to be like the low libido gains weight person. Like I can tell you, right? Because it's the same exact pattern of imbalance now that you're going to tend towards in 20 years if you don't do something to intervene and resolve those imbalances, which you can do at any time. So absolutely, the best thing we could tell people is come in your 20s, get your patterns of imbalance all sorted out, and then enjoy hormone balance now, be more fertile now, and then 20 years from now, enjoy a very smooth transition to menopause without all this perimenopausal annoyances that everyone's plagued with.
Because and I know we are getting a little bit off track here, and I think it's amazing that there's a lot more awareness around perimenopause and menopause. But I talk about this a lot, and I probably have done across the podcast. And my view is very aligned to what you're talking about. And your health, what you do in your preconception period, across your childbearing years, what you do in your like preconception, throughout your pregnancy, your postnatal, all of that is going to impact or affect how you turn up later in life. And obviously, I talk about it from a health and well-being and a bit more training perspective, but what you're talking about is exactly the same. So it's really your overall health. So if you're exercising and ticking all the right boxes in your training before you fall pregnant, it's going to make your pregnancy journey so much easier physically. If you maintain that journey throughout your pregnancy, even though it's really difficult sometimes to keep turning up for yourself, that's going to make things so much easier in your postnatal. And your postnatal recovery is going to impact how you turn up into motherhood and the years down that. And if you just keep that cycle going, so it's exactly the same what I'm talking about and what you're talking about. And I think what we need to start doing is really encouraging women to start thinking about this journey a little bit earlier. Let's start thinking about this journey when we are maybe in our mid to late 20s and start really thinking about our health and well-being and looking at all of these boxes. And I love the Eastern medicine perspective And
Mhm.
all the things that you've just been saying are so incredible. But before we wrap up, because I know I've been talking to you for so long and I feel like I could talk to you forever. But before we wrap up, there's one thing that I do really want to ask you, and that is about acupuncture, because we've talked about acupuncture a lot. And I feel like a lot of people already use this for their fertility treatments. And what I'm sensing is that your approach is actually quite different to other practitioners that maybe just use your acupuncture or a little bit of the Chinese herbal medicine approach where they may combine the two or they may just go for acupuncture. Can you talk about why your approach is different and how you would use acupuncture to address issues related to infertility? I know you've said you use acupressure, but yeah,
Mhm.
let's talk about why that approach is so different because I think that's what delineates it a little bit. Because a lot of people just, they're like, I'm going for acupuncture, but there's this whole other, you've just opened up this whole box of other things. And I think it's really important to understand what the difference is.
Yeah, it is really important. And I think it speaks a lot to that variance in practice that I mentioned earlier, where depending on what school you went to and how you were trained, you as an acupuncturist, as a provider, will be very different. You can utilize tongue diagnosis or not. You can utilize pulse diagnosis or not. You can utilize herbal formulas or not. But what people tend to know about mostly is one method, which is acupuncture needles. And that, again, out of the 5 branches of treatment we have to utilize in traditional Chinese medicine, acupuncture is only one. It happens to be the famous one. There was a couple of movies that showed it, and then people got it in the 70s and like really fell in love with it in the US, for example. So it spread. And that one method is what people seek out. And I think that's because that's what we're titled, that's what we're licensed as in my area at least. And when people call the phone number, they want to know if I do acupuncture. So that's when they come to me. But then once they come for that method, I get the opportunity to then educate them about the other 4 giant categories of treatments or methods that we could also use. Because ultimately, what someone's calling me for is not they want needles in their legs, they want to be fertile, right? So they think that needles in their legs are going to make them more fertile, which it does help with that, sure. But they could also stimulate those points on their ankles themselves at home every day, and they would never have to drive to an office to get someone to stick a needle in that point. You can affect the same change with your own finger, massaging it 1 or 2 times a day, every day. So once we change our mindset from method to the goal we're trying to accomplish, that just breaks the glass right in between that barrier. You may have come for this, but now let me teach you about these other 4 other ways in addition to that one that can make a huge impact on your life. And because it's not, they also come like they want to know how many times they need to come. And I say, okay, just come on Monday and we'll talk about it then. Once I have a chance to explain all these other parts and see which parts you're interested in, because that's the other beautiful part is that if they just want me to stick needles in their legs, I will. But once they learn about these other options, they're like, "Oh, I don't even have to come again. I can do this at home and I can do it every day instead of once a week or once a month. This seems like better, right?" So, I think the misconception is that acupuncturists just do acupuncture, and that's unfortunately a misconception that a lot of acupuncturists think as well. So, you'll see like in acupuncturist forums on Facebook, for example, you'll see, I would love to work online, but I can't because I'm an acupuncturist. How are some of you guys doing this? And those of us who have been working online for years now are like, yes, you can work online. Yes, you can help people with other modalities. You're forgetting about 4/5 of your medical tradition, right? Go utilize the other ones too. And then all of a sudden it becomes much more possible that you can combine those modalities. And if somebody's not at all interested in needles, they don't have to be. They don't want to take any sort of herbal formulations because of a medication they're on or quality concerns or what have you, or access to where they live. They don't have to take the herbal formulas because what we're doing is not one method or one treatment. What we're doing is we're getting you fertile naturally through these methods that have been working together as this like coherent, comprehensive system for 3,000 years. But it's so rich and so comprehensive that you can choose among thousands of things that will work for you and that resonate with you and that you become part of your lifestyle. That's not going to look the same from woman to woman.
Hmm. I love that because a lot of people don't venture down the acupuncture route because they don't like the needles. So
Right.
what you're saying is that doesn't mean that you don't
Don't
have
want
access to all this. Actually, you
it.
can use Eastern medicine and you can use it for fertility without
Mhm,
even having to go down the acupuncture route. And
mhm.
instead, you could actually use the same points and do acupressure. And actually, if that's not even interested to you, we can totally do something else completely different. I love
Yeah,
that. That's so
yeah,
great.
yeah.
Now, there is one or two more questions that I'm going to ask you
Sure.
because you've mentioned basal body temp. And for people that know me and listen to the podcast, they know that I am obsessed with my aura ring, which
Oh,
obviously measures my body temperature
mhm.
overnight. So I'm very connected with a lot of different things in terms of my health, and body temp is one of them. How can you utilize that? Let's say someone was working with you and they wanted to track their basal body temp or use technology. Can you join modern technology to what you're doing now?
Yeah, and I think it's just naturally evolved side by side. So I
Mhm,
don't I try to be, I'm a little lean towards, like, more of the purist ancient modalities side
mhm,
whenever possible.
mhm,
But not entirely, of course. I have artificial lighting in my house. I'm not like a total purist. So the people who come to me and they're like, I would like to show you my charts, my basal body temperature charts. Maybe they're using the ring or they're taking it old fashioned thermometer every morning and they show me those things. I can interpret that into our existing framework, right? So if their temperatures are always low, that tells me that they have probably a kidney yang deficiency and their yang tends to be low and they're a colder person. If their temperatures are always high, then I know they're more of a yin deficient person that's generated that heat and dryness issue. So
mhm,
it tells me right away, like this person probably has luteal phase problems or maybe a recurrent miscarriage situation, or this person can't ovulate, doesn't ovulate, or doesn't know when their next period's coming. If they have those charts that again are very up erratic, like the jagged tooth up and down, that would indicate the liver qi stagnation. So it's not that I'm looking at the numbers per se and I'm like, oh my gosh, this changes everything. No, it's never going to do that. But it's another indicator. It's another piece of information. If someone comes, it's similar to someone coming in with their blood work and saying, "Look, I have my AMH is terrible," and I'm like, well, "Yeah, you have terrible egg quality too. Your yin deficiency and your blood deficiency already told me that, right?"
mhm,
Or if they come in and they have low progesterone tests all the time, whenever they're checked, it's not going up at all in their luteal phase. I'm like, well, yeah, you already probably guessed that because you have kidney yang deficiency. So this new technology, this new lab work and new data that we're able to get with new devices and new tests, it's all just another piece of data that can be used in my eyes like another tiebreaker. If I was
mm,
between two things and we have one more piece of data, it's okay, put it in that pile. But it's
mm,
never going to be something that like changes the way we do it already or would change the course of treatment strategy or something like that.
mm. Amazing. Now, I've got my last question for you, something that I ask all women that come on, or everybody that comes on the podcast. What's the one thing that you wish all women knew before they had a baby?
Okay, one of my favorite things to tell women is about breastfeeding. So
Mhm,
your babies are going to be very different from each other and your things that are natural are not always easy. So I was under the impression that breastfeeding is natural, so breastfeeding will be easy. And that was not easy with either one of my kids. And I needed a lactation consultant for each case for an entirely different issue with both of my children, 3 years apart. So that's the biggest thing I recommend that women do is to not assume that this whole pregnancy, birth, breastfeeding thing is just because it's natural doesn't mean it's all going to be easy. Those are two different things. And that a lactation consultant or whatever they're called in your area, wherever anyone lives, are worth their weight in gold and never ever be afraid to reach out to them. If they offer a checkup or a consultation and you don't even think there are problems, take the consultation anyways, because they can give you tips that can help prevent other problems. This is just a really important thing to me. I think we don't talk enough in society about how good it is, how good breast milk is for babies. When we look at formulas, they keep adding things to them. They haven't figured it all out yet, so they haven't added everything to them. And now with all of the exposures in the chemicals that they're finding in the formulas sometimes, it's just a lot of issues that could be avoided if we simply told women that breast milk is often, usually, the healthier choice for the baby. If there are problems and you can't breastfeed, obviously we're super happy to have other options and other technologies to come in and fill that gap. But the fact that we're not saying often that it is better for the baby, that it does change in response to your baby's saliva when your baby's sick, your breast milk changes to help them, things like that. It just needs to be said more, because I think if more people were told that, then they would look into it more and they would go through the more challenging parts, which, believe me, there will be some challenging parts with it, if they know that there is a reason. And I think people are just being told there's no reason, don't try. It's the same. Formula is just as good as breast milk. And I know there are a lot of shadow reasons for saying that to people, because we don't want to make anyone ever feel bad about any of their parenting. And sometimes it's just necessary to say things that are true, that things people don't want to hear. So in my work now, I carry it all the way through the breastfeeding phase. Because of that, I carry my program of fertility coaching from preconception care through natural pregnancy to ways that you can help alleviate your symptoms while pregnant safely, and then how to make your labor more efficient and less pain, how to have lower delivery interventions, how to have a smoother postpartum recovery, and how to troubleshoot some of those breastfeeding issues. Because I think it is a whole thing. It's a whole cycle. It's not just like getting pregnant. Someone's positive pregnancy test is not the end of the story. That doesn't get you to the next point, the next year. It's all of those other things along the way. And the more we can follow it through, all the way through the process like that for someone, I think the better, rather than just having goals like get pregnant or have the baby.
Wow, isn't that crazy about how saliva changes breast milk? I actually didn't know that. And for those that are listening, because I agree with so much of what you've just said that, but I'm just going to do a shameless plug here. So for those that are listening and are interested in breastfeeding, there are podcast episodes done with Dr. Robin Thompson, who is an incredible midwife who is also a breastfeeding specialist, I would say. So definitely check out that episode. I've also done episodes with a lactation consultant, which is what you've just mentioned as well. So those are in the earlier episodes. So definitely check those out. And in terms of how people can work with you, because you've mentioned online programs, and for someone, a lot of my audience is in Australia. I think that's really incredible that I'm now opening them up to someone who specializes in this area in infertility. So how can people go about working with you?
Yeah, so I find so much value and so much success in working with people online that I'm actually in the process of transitioning out of my on-ground office entirely right now. By the time this airs, I'll probably not even be working in person at all anymore, because I can reach so many people, like you said, around the world with an online program. So currently I'm offering what I call the Cultivate Fertility program. And it comes with a work at your own pace module program that teaches you everything we've discussed today and much more about how to work through all of your patterns of imbalance. And then while you're working through that at your own pace, we have a group chat going on, a discussion that's live every day with me, so that as you are learning new things, as you have questions that are coming up, as you're trying new things and things are hopefully going really well, but of course we know there will always be setbacks and questions along the way, you have access to me and to this small community of women also trying to conceive that are going through the same thing with you, learning the same things that you're learning, that we can talk about together every day if you have questions. And it's just continued support. So that's the main way that you can work with me. And I do offer everyone a free trial month at the beginning, just to see what the program kind of looks like, how it operates, how I deliver the information, and to get in that group for that first month and see how I coach people and see what fertility coaching in this long-term model with daily access to me looks like and how it works.
Amazing. And I absolutely agree with you in terms of, and I think I've said this before, it's not just about the pregnancy. It's about the time before, it's about the pregnancy itself, it's about the birth, it's about that fourth trimester, and then into life as a new mum afterwards. And what we do as women in this aspect of our lives really does impact how we move into later stages. So whatever we can do to help make ourselves the healthiest versions of ourselves is super important. So thank you so much for your time today. It's been so enlightening, and you've given so generously in terms of your time and your energy. So thank you so much. It's been amazing.
Thank you for having me and letting me share this with so many people. It's really important to get the message out that there are natural ways to improve your health and your fertility, and that you don't have to jump straight to assisted reproductive technologies. We can save them for if we really need them later down the road.
Amazing. I love finishing on that point because I completely agree with that. Thank you so much. And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.